So, hello, Sama.
I
Hi, can you hear me properly? The mic
Yes,
is working properly? Okay.
yes,
Okay.
it's a little bit acoustic, but
Oh,
we can hear you.
okay, let me change it to the.
Okay.
Okay, is the quality better or is it the same?
It's we can hear you, but it's like kind of loud, but we can hear you. I just
Okay,
found out
okay.
there is just research seminar going on, which was today. So I don't know if we will have more participants, but this will be recorded, so they will be able to see it anyway.
Okay, okay.
I think we will wait till 7:05 and then I will start. You can share your
Okay,
screen. I made you host.
okay.
Okay, so in our first two seminars, we usually had like 15 participants, but there was this research seminar which I found out started. But this will be recorded, so we will be able to put it on YouTube and they can look at it later. But I'm sure it will help others. So don't look at the
Okay,
participants. So I think
okay.
okay, so everyone who is here, I think people will keep joining. Thank you for joining us. This is our third seminar, and it is about histopathology. As in our second seminar, Fatma explained, like in Pakistan, the pathology is subspecialized into different FCPS trainings, so it's not combined. Histopath is different, hematology is different. So Ahsan has joined us from Chughtai and he will be explaining about histopathology residency in Pakistan. He is currently PGY3 and so I will just let him start now. And thank you, Ahsan, for joining us.
Yes, thank you, Sama, for inviting me for this talk about residency programs in pathology in Pakistan. So I'll be talking briefly about it. So what is pathology? When I was a medical student, I didn't had an idea when I joined the medical school what pathology is. I didn't even knew what pathologist did and even if it the pathologist ever existed. So only thing that I knew was that pathology is a subject in third year and fourth year, and I didn't knew that we can choose it as a specialty. So what pathology is, we receive body tissues and body fluids of different specimens, and then we examine it under a microscope to make a diagnosis. So there are two fields of pathology: anatomic pathology or clinical pathology. So clinical pathology is microbiology, even virology is included in this, hematology, blood banking, chemical pathology. These are the clinical pathology aspects. And histopathology is included in the anatomic pathology. So we deal with the tissue biopsies, the tissue that is removed after a surgery. It gets into a histopathology lab to be cut and sectioned, and then we examine it under the microscope. So what are the tissue samples that we receive in histopathology? So they can be pap smears. These are cytology specimens that are used for screening purposes, from cervical pap smears, fine needle aspiration cytology. If there is a visible lump, then we aspirate material from a fine needle, and then we prepare the smears and examine it under the microscope. So FIND or FNAC is one aspect where there is direct interaction with the patient. So, and any tumor resections and any biopsy specimen that is removed after surgery, they also get into the as a tissue samples in the histopathology section. So histopathology, what does it includes? As the specimen is received, first it's received in the grossing room, we gross it and then sign out FNAC and frozen sections. These are the things that are included in the histopathology. We'll talk about it one by one. So here is the crossing. So resident is mostly responsible for crossing. It's the serial slicing, or you can say the bread loafing of the specimen. We can visualize any abnormality, and if there is a tumor, we see it under the gross examination and describe the tumor. And then we put the tissue in these histology cassettes. So after putting the tissue in histology cassettes, next step is to make a block. We put some uh, paraffin or wax to make it a solid form, and then we use a microtome blade to slice it into a thin section so it can be put on a glass slide, and then later it can be stained. So here is the end product of crossing, a glass slide, which is ready to be examined by a pathologist. And here's the next step, which is the sign out. So seeing a glass light under a microscope, it's called a sign out. Usually the residents do their sign outs with the attending physician or the consultant pathologist, and most of the teaching, it is carried out on the bihead or the multi-headed microscope. On the one end of the microscope, it's the consultant pathologist, and at the other end, there is a trainee. So there is one-on-one teaching session, and we learn the histology or the glass slide by this. And in pathology terms, we call it a sign out. So here is a video. So this is how a pathologist look in the scope to the ready glass slide to make a diagnosis. So here is an example of a cell that we look under a microscope. And one of the reasons why people choose pathology is that we can see the pathology with our own eyes. So this is a Reed-Sternberg cell. It is a binucleated cell, and nothing else look like this. So when we see this cell under a microscope, we make a diagnosis of Hodgkin lymphoma. So we are making a diagnosis, and just along with it, we are also looking at the abnormal cells. So we have covered two aspects, grossing, sign outs, and the other one was FNAC and the frozen section. Frozen section is like a rapid diagnosis. If there is an operation going on and the surgeon, they can send us margins. If the margin is positive, then there will be an impact on the surgery. So the turnaround time is around 20 minutes. So in 20 minutes, we have to make the diagnosis and tell to the surgeon. So talking about the histopathology residency here in Pakistan, it's the anatomic or clinical pathology. All the pathology residency programs that are included under the CPSP, it's a 4-year programs and the requirements. So one have to pass the FCPS Part 1 pathology exam, and once it's a general pathology exam, and after that one can choose any of the subspecialties of pathology like chemical pathology, histopathology, hematology, or anything. So the part 1 is not specific for any subspecialty of pathology. And after 2 years, there is an intermediate module or IMM. And the final part 2 exam is after completing 4 years of residency training. So before starting a pathology residency or committing to anatomic pathology, it is the pathology elective or rotation or observership that you can do anywhere in any histopathology lab. Like Chughtai lab is also offering Shogat Khanam at Lahore. It is also offering the elective programs. Khan, you can also apply there as an observer to get an idea and familiarize what pathology is. Because once you do a pathology rotation, you will have an idea what pathologists do. And after rotation, there are two possibilities. Either you're gonna love it or you would won't like it at all. So before committing pathology as a career, I would recommend you to go rotate in that pathology program and see whether you like it or not. So here's my story, why I choose pathology. So it was in like the 3rd and 4th year of pathology. There was an online program, online lecture series, Medical School Pathology. It was a website, medicalschoolpathology.com. It had all the lectures of Robbins pathology, and it was taught by a US teacher, John Manarsek. And at the end of these Robbins lecture, there was a virtual histopathology lab. So there was scanned slide, and he used to teach those slides. So that really that specific pattern of the disease and then apply it to make a diagnosis. So the virtual lab was called Rock Lab. So it was my first experience for in the histopathology, and it was a virtual online histopathology lab. And one of the other aspects which actually uh, motivated me was like I always wanted to be a, a a doctor, but I didn't know what specialty I would choose. So one thing that excited me in pathology was correlating pathology with the different artworks, and that is called path art. So we combined pathology and the art. So, so here is a painting of Van Gogh. The famous painting is called Starry Sky. It's in the Museum of Modern Arts in New York City. And this pattern of starry sky, it can be implied in the histopathology image also. Like this is a picture of a hot Burkitt lymphoma. So the lymphoma cells are small, round, and blue. So is like a night sky. And then there are macrophages. These are light staining. So these are like the stars in the sky. So this one of these image, it looks similar to the famous painting of the Van Gogh, The Starry Sky. So here is how we can correlate pathology with the artwork. So here is another image. Here's image of a skin biopsy, and the collagen in the dermis, in the keloid, it looks like a chewed bubble gum. So here's an image of a chewed bubble gum, and it looks similar to it. So it's another example of how we can correlate the histology images with the pathology art. And I posted it on Twitter, and there was like comments on Twitter after this picture. Like, I have a feeling that this image is going to stick on my head, or will be chewing on this idea for a while, just to correlate it with the bubblegum appearance of the collagen. So we come across the histology images, and every histology structure or images have a distinct shape, and we can always compare it with other things. So this is the skin biopsy with the whirling pattern of the keratin on the horn cyst. And to me, it always looks like if there is a spider web, these rounded structure of keratin, they look similar to the spider webs. And this diagnosis is from the image of seborrheic keratosis. It's a benign condition of skin. And these horn cysts, or the rounded keratin structure, they also look similar to this painting. It's a painting of Gustav Klimt, and this famous painting, it also have this rounded and concentric rings. So to me, it always looked like if these are the similar to the horn cysts of keratin. So I made this artwork just by comparing the two. And this was a neutrophil. So this neutrophil had two lobes, two nuclei, and this looked like an Englishman. And this is a picture of a chorionic villi. So chorionic villi, they really come in different sizes, different shapes. So one of these chorionic villi, to me, it looks similar to a rabbit. So I made this pathology out of it. So we all played this game, Super Mario game, in our childhood. So one of the pathologists, he made a similar game from a skin biopsy. So here it is. Like, this is the layer of skin, the epidermis and the dermis, and this is the scabies that infects the epidermis. So he made this pathology art or a game. So this was all from my side. And pathology, when you come into the pathology lab and learn about different structures and different diagnoses, it's a fun way to learn when we correlate with the real life. And like, I always compare cell as some individual or a person or a painting, and it's really a nice way to compare this. And if you have any questions, I can answer them specifically.
Thank you. It was very interesting, and it will be put on YouTube, so I'm sure people will be able to see it after, because right now I think they have different research seminar, and there is prof season as well. So yeah,
Mhm.
it's very helpful, and it was a very, very interesting presentation and very brief and to the point for the medical students. So Dr. Nayab asks that everyone says histopathology is the hardest specialty. what makes it so hard, and would you say that? Yes, that's actually my question too, and I have heard it a lot.
Yes, histopathology, yes, it's true. Histopathology is one of the hardest pathology specialty. So if the perception in the medical school is like the pathology, if you go into pathology, it's a chill program. So that's not the case in histopathology. In chemical pathology, you do get time to do other stuff, but histopathology stuff, because where I am doing a residency, it's like 9-hour residency, and we don't get enough time to do extra stuff. So the crossing, it is hectic. Like we have to do like around 60, 70 specimens a day. So it is quite hectic. And the sign outs, there also, if you get into a good residency program, there is a large burden of cases. So like you do sign out like 30, 40 cases a day. So it consumes almost like 7 to 8 hours of your time during the day. So you don't get much free time during the histopathology residency. It's similar to doing like other specialties like surgery or medicine. So the time you spend in the histopathology lab, it is comparable to the other specialties like surgery and medicine.
Okay, I hope that answers your question. And um, so Varda asks a general question, like a choice between private and government setup for histopathology. Um, yes.
Okay, so the main difference is quality of training. So in private setup, there is more workload. So if there is more workload, you're gonna learn more cases. You're gonna see more cases in your residency, and you're gonna learn more. So one thing is that, and the other thing is the sophisticated tests like immunohistochemistry, the advanced testing. It is not offered in the government setup usually. So it is the other thing that also makes you learn more things. So these are the two things. Number of cases, they are more in the private setup, and the quality of histopathology training, it's better. So I would recommend you to choose a private setup, and you can choose anyone, like if you're in Lahore.
Okay, yes, I think just to add on
Yes,
it,
yeah.
like, oh, yeah, the Dr. Nayab asks if you like more than one field like histopathology, yeah, hematology and microbiology. Is there a way to pursue all three?
No, there isn't a way to pursue all three fields, but you in so here comes the rotation part. So you should, before starting the residency program, you should rotate at the program. So you can rotate in chemical pathology for 1 week, you can rotate in hematology for 1 week, and rotate like in histopathology and in 1 week, and you can get an idea what you want to do. So doing a rotation before starting a residency program, this is what I would recommend, because you can't change after doing it, after starting it.
Okay, I hope that answers your question. But one way to do that in USA it's like this APCP, but in UK or Pakistan it's separated. So if you are interested in all of them, so US might be a good option. And I am not sure if you remember about FCPS1. If there are many other participants here, if they can answer. Mubashir asks any resource for paper 2 of FCPS1. If there is anyone here who has passed FCPS1, I can unmute them and maybe.
Okay, so doing the FCPS part, so part one is like most of it comes from the first aid book, and the other thing is past papers. So you can collect the past papers, maybe that can be helpful. But for paper two, if you have any one who has recently done the exam, so that might help.
So there is another question, and it's I think a very universal question that there is saturation in histopathology, and there isn't money in the field? Would you say these are true?
If we compare pathology with the other specialties like surgery or gynae, so there is a difference in the pay scale. So only time I would recommend you to get into histopathology is when you like it. If you want to become a histopathologist, then this is the only time I would recommend. So if you don't like it, you just rotate it and you will get an idea if you want to do it or not, because it is true, like the money wise it's less paying than the other if you do a private practice in medicine or surgery or gynae, unless
Okay.
you establish your own lab.
Yes. So one of the questions I had was that if where it gets busy in histopath, that you are going in the morning, especially in Pakistan, if you are working in big setup and then you come around night, do you think do you get time to study and to like follow up on your studying about cases, or do you think like the practical experience in lab is enough? So how do you manage your training with reading?
Okay, so training here is hectic. So what we do is after we get free from the, like it's 9 to 6, so after 6 p.m. we do the reading for the test or any other stuff. If we want to post some stuff on Twitter, that I do after 6 p.m. after I get free from the lab.
Okay, so there is another question. If someone wants to go abroad, so which pathways could MRCP, FRC path? I'm not sure if you are able to answer it.
So FRC path, many of the people in our setup, they are doing FRC path. So requirement of doing FRC path is like you have to be in a residency program in your home country, like you have to do FCPS. And after 2 years, you can appear in FRC path part one, which is a basic exam. And then FRCS part two, it's just like the FCPS part two. So there are slides. So once you get into the residency program in your home country, after that you can apply for the FRC path in the UK. Or the other pathway is just doing the PLAB and starting the residency there in the UK. So there are two pathways.
He asks about MRCP as well, and I think you have answered it.
Now, I'm not sure about MRCP in pathology. I don't even know if it exists or not. So FRC path in pathology is the preferred way if you want to pursue a UK degree.
Okay, I think that's all the questions. So for everyone, thank you for joining us. We actually recently started this interest group even. We don't have this trend of interest group in Pakistan, and we didn't have any
Yes.
pathology interest group. So I uh, uh, kind of correlated with my own medical journey, how I wanted to go into path but didn't have much guidance. So to make things easier for my juniors and everyone, I initiated this group, but it's still in the starting process. So with time, we will get more audience and get involvement of students. Currently, there is prof season going on in students in college, so we didn't have much participants, but I'm sure it will be put on YouTube. And with time, we will make it more broader and upload more opportunities, more educational content for everyone from undergraduate to postgraduate studies. So kind of taking baby steps towards it. And thank you, SN. Like
Yes, I agree.
this brief, it was very good presentation, and especially your tweets and correlation of arts and photography. And we would love to have more sessions with you in future. And thank you for
Yes,
joining us.
sure.
If everyone has any more questions, we still have like 10 minutes. Okay, someone asks about hematology webinar. Yes, I will send you a YouTube link. We have like this is our third session. The first one was about residency in USA. So I will upload it too, and the hematology one and this one as well. And you can follow us on Twitter. I will post it there. And I guess
Yes, exactly. And if you have any questions, you can also ask in the Twitter direct message. We'll be more than happy to answer any of your queries there.
yes. Yeah. The Twitter is it's Twitter. I will just send the tag here for SN Twitter too, and for the our own Twitter too. So for it's our Twitter is KemPathology. I'm just posting it on a chat, and I will also post the Twitter link to SN account, so you can ask him any question you have. So it's in chat. Please refer. You
Yes.
can check the chat there. There you go. So I have posted a Camp Pathology and the Twitter account to of SN as well. So you can open them, and we will post the links there. So we are just starting, but hopefully it will get bigger. Thank you
Yes,
everyone for joining
and
us. Okay.
yes, and we also get a lot of students from the KE that rotate. They come in the evening and spend like 2, 3 hours in pathology. So if you're interested, you can also contact someone who is sending the students here at Chughtai Lab. So to do a rotation in the evening.
Yes, they are providing great opportunities. So if everyone is interested in doing internship, there is another pathology Chughtai interest group, and it is basically focused towards just internship. So you can check that page. I can send the link to that as well in the group. And there's another question that Chughtai Lab residency is offered in Lahore only. I think yes, it's only in Lahore, right?
Yes, only in Lahore. Yeah.
Okay, so thank you everyone, and good have a great evening.
Thank you. Thank you, everybody.
Goodbye.